Good day and great health. My name is Dr. Jericho Sarko of Ohio Specific Chiropractic. I'm a pediatric, family wellness, and upper cervical specific chiropractor. Today on this video, we're going to talk a little bit about the correlation between the condition called colic and the upper cervical spine. Now, it must be known that in chiropractic, our goal is not to treat any specific condition, disease, or sickness of the body. Our main goal is to improve the integrity and function of the nerve system, which controls all the functions of our body. Once we improve the function of the nerve system, we can improve the function of the body, which correlates with health and well-being. Now, before we delve kind of deeper into that, we're going to do again a little crash course in anatomy and physiology. There's going to be four main structures that we're going to focus on of the upper cervical spine. First is the foramen magnum, found at the base of the skull on the occiput bone. Next is the atlas, or the C1 cervical vertebra. Next is the axis bone, or the second cervical vertebra. Now, the fourth structure we'll focus on is what's called the brainstem. The brainstem leaves the base of the skull from the foramen magnum, and it's going to be housed and protected by the atlas and axis vertebral bones of the spine. Now, along with those four main structures, we're also going to focus on four main nerve groups. The first nerve we're going to focus on is called the glossopharyngeal nerve, or it's called cranial nerve 9. The glossopharyngeal nerve is going to exit the skull very in close proximity to the foramen magnum and the upper cervical spine. It's going to come down out of the skull, and it's going to supply function to structures of the tongue, throat, tonsils, and ears. The next nerve we're going to focus on is the vagus nerve, or cranial nerve 10. It also comes out of the skull at the same area as the glossopharyngeal nerve. It's going to supply a wide array of different structures, but we're going to focus on its function related to the heart, lung, liver, stomach, and overall gastrointestinal or GI system. The third nerve we're going to focus on is called the spinal accessory nerve. It also comes out of the skull at the same area as the glossopharyngeal and the vagus nerve. It's going to supply function to the muscles of the neck and shoulders. Now, the fourth group we're going to focus on, I kind of combined two nerves, but they're going to be the cervical nerves. They are the C1 and C2 cervical spinal nerves. They're going to leave the brainstem. The C1 cervical nerve is going to leave the brainstem in between the occiput and the atlas bone, and then the C2 spinal nerve is going to leave the brainstem in between the atlas and the axis vertebral bones. Now, the C1 and C2 spinal nerves have branches that are going to connect with all three of the glossopharyngeal, vagus, and spinal accessory nerves. They're not only going to communicate with those nerves, but also the brainstem and the brain above, functional information. Now, what is so important about these four nerves and the brainstem? Well, they're both parts of what we call the nerve system. Now, what's the job or the function of the nerve system? The nerve system does four main things. It controls all the movements we make. It controls all the sensations we feel. It regulates all our body organs. And it relates us to the outside world. Now, those nerves, or our nerve system in general, can get stressed. When nerves get stressed, it affects their sensitivity, perception, and behavior. There are three general types of stresses that affect the functional capability of the nerve system. They are physical, chemical, and emotional in nature. An example of a physical stress that can affect an infant can come from the birth process. Actually, more and more prevalent use in the modern birthing process, we see an increase in the physical stress. Next, an example of a chemical stress can come from the more and more use of formulas used in the infant's diet with all the different synthetic and artificial ingredients, and also the lack of important nutrients only found in mother's breast milk. An example of a emotional stress can be the cry it out method. This is where the child is trying to be taught how to self-soothe itself, and this actually can create a type of emotional stress. Now, all three types of these stresses that can affect the nerve system, they affect the nerves by putting tension on the nerves and creating body imbalance. Now, it's the job of our brainstem to adapt all these stresses that affect or bombard our system on a daily basis, and it's trying to bring the body back into balance and ease the tension off the nerves. Now, in general, the brainstem does a great job of adapting all these stresses of the body, but depending on the quality and quantity of stresses that affect our body on a day-to-day basis, the brainstem can't always adapt to the stresses. If the body cannot adapt to the stresses, if the brainstem can't adapt to the stresses, it's going to create an abnormal compensation. One specific type of abnormal compensation that we deal with as chiropractors is what's called a vertebral subluxation. A vertebral subluxation is a physical presentation of an abnormal compensation. So I'll just draw in our diagram here, I'll draw just a simple version of a vertebral subluxation. So in this case, this example, we'll have the C1 cervical vertebra is going to compensate and laterally shift over to the right, creating body imbalance. So as it shifts over to the right, it's going to get closer to the neurological tissue that it's trying to protect, and any and all nerves that bone kind of comes in contact with, it's going to create an impedance and it's going to create some inflammation and irritation. My little squiggly lines here are going to represent that nerve tension on those four main nerve groups. Now, when we have nerve tension and body imbalance, it's going to create abnormal sensitivity, perception, and behavior. One creation or presentation of abnormal sensitivity, perception, and behavior is what we call symptoms. Now, if we focus these symptoms on what the condition we're focusing on is going to be colic, some of the general symptoms associated with colic are fussiness, irritability, excessive crying, difficulty breastfeeding, acid reflux, stomach pain, abdominal pain, gas, burping, bloating, distension, diarrhea, constipation. Now, if we look at all these individual symptoms, we can see that there is a strong correlation to these symptoms and their association with these nerves, especially the three cranial nerves. So if we look at the glossopharyngeal nerve, the function to the tongue, throat, tonsils, and ears, we can see that can create issues with reflux, trouble latching on, difficulty breastfeeding, just general irritability, maybe because there's inflammation creating in the ears or the tonsils. When we focus on the vagus nerve, we can see these symptoms also are associated with the structures that are supported or innervated by the vagus nerve. Again, creating fussiness, irritability, crying, increased heart rate, respiratory rate from the heart, the lungs, and just general distension, gas, stomach pain, bloating. Those are all going to be affected by the GI system, the stomach, the liver. Also then further down, diarrhea, constipation, bloating. And then the spinal accessory nerve, the muscles that supply the neck and shoulder, if there is nerve tension on those nerves, those can affect breastfeeding, more not just from a latching standpoint, but a lot of times an infant who's dealing with colic, they have not only trouble latching, but problems breastfeeding on one breast, the left breast versus the right breast. Then that again is indicating that there's some irritation in the nerves, so they won't want to turn their head left or right, which can associate with the difficulty breastfeeding. And then the C1 and C2 spinal nerves are all going to communicate and associate, and only going to add even more tension to those three main cranial nerves. Now, what is the major medical approach or model to treating colic? There's going to be two major types of treatment options. The first is usually going to involve some type of proton pump inhibitor. These are drugs such as Zantac, Prilosec, Pepsin. The problem is there's very little clinical research that indicates any real significant improvement in colic in an infant who is given these proton pump inhibitors. There's actually guidelines set up by the pediatric gastroenterology, hepatology, and nutrition guidelines that actually are showing indications of opposite prevalence or positive use of using PPIs with colic. If anything, there's actually an increased use of increased prevalence of side effects. Some of them are even the same symptoms they are trying to alleviate. Once usually that first, second, or third round of PPI drugs are used and there's no real change in the colic symptoms, the second main approach they use is just called the "they will grow out of it" approach. This is where, in essence, the medical doctor will kind of wash their hands from the situation and will just indicate that the infant and the child will learn to cope with this dysfunction of the body and learn to deal with it on their own and heal from it. Now, what is the chiropractic approach? Well, our main goal is not, again, to look at individual symptoms, but to look at one main cause of these effects. So we can see that symptoms are an effect of abnormal sensitivity, perception, and behavior. And what's causing that is going to be nerve tension and body imbalance. So our focus then is going to be looking at the vertebral subluxation and correcting and reducing its presentation. So once we reduce the presentation of a vertebral subluxation, we can then reduce abnormal compensation, and we can improve adaptation quality, specifically of the brainstem area of the nerve system. Once we improve the neurological function and the integrity of the upper cervical spine, including the brainstem, your body has a better ability to adapt to stresses. It can bring the body in better balance, and it eases tension off the nerves. Once we have that, we can see that it can improve the sensitivity, perception, and behavior of those nerves, improving their movement, sensation, regulation, and relation to your internal and external worlds. So that's why there's a real high prevalence of patients and our practice members who bring their infants to us who are dealing with colic. And as we adjust vertebral subluxations, we see a great reduction and resolution in symptoms associated with colic by not trying to treat the symptoms, but really adjusting a main cause of the vertebral subluxation. If you have any more questions about how colic is associated with the upper cervical spine, please please reach out to me on my website at ohiospecific.com. Thank you very much.